Things I'm learning as a third-year nursing student. First day of med-surg simulation, we learned about nasogastric tubes. I don't actually have one, but I do have my phone charger. So what it is basically like a flexible tube that's put through the patient's nose into their esophagus, into their stomach. And this is just to do feedings, medication administration, and also to remove contents. First, put someone in the high semi-Fowler's position. If you don't know, that's like 60 to 90 degrees. And then you would measure out the tube so you know how far you should put it down into their nose. And we were taught to the nose until the back of the ear, and then you would measure it up until the front of their chest, like right here. The Savoid process, I think it was pronounced as. You get that length and you use the tape to distinct exactly how long the tube has to be. While you're inserting it into their nose, you want to make sure that they're drinking some water. And the only way to ensure that it's located in the right spot is by getting an x-ray done. So you would ensure that you secure the spot by placing tape on the person's nose. Some examples of patients who would need a nasogastric tube as a feeding are stroke patients who has dysphagia, or people with trouble swallowing, or anyone with like severe malnutrition. It would be used for medication administration for people who have severe weakness, trouble swallowing. In cases where you'll be removing the patient's stomach contents is if they had like a drug overdose or if it's a poison case.